forcing new med school graduates to spend their first 5 years of professional practice in the Quebec public healthcare system. That's what the health minister intends to do with his Bill 83.
If they're committing to do it, and at the end they change their mind, but the consequences will be very expensive.
If the bill becomes law, doctors who don't complete their public service could face fines from $20,000 to $100,000 per offense per day they work in the private sector. For a second offense, the amount would double. Definitely for the new doctors, you want to impose a sense of social duty.
Yes. It's very clear.
The goal is to address concerns shared by the College of Physicians over the increasing number of doctors trained in the provincial Medicare system leaving for the private sector. Out of nearly 22,500 doctors in Quebec, 775 of them work exclusively in the private system. That's a 70% increase since 2020. The trend is especially evident for new doctors. They are also more likely to leave the province to practice elsewhere. Opposition parties agree with the principle behind the bill.
If they get their education paid for by the taxpayers, they should give back for a number of years in services in the public system, because otherwise you pay twice or three times. You pay for their education, you pay for the public system, and then you pay when you go private, for private services.
But they say they will have many questions when they study this piece of legislation next year.
I hope that in this bill, he takes into account Quebecers who may go abroad for a couple of years, for example, to do their stage.
The Federation representing medical residents believes this bill could be discriminatory for young doctors. But even though it affects a small minority of new physicians, the health minister insists the province needs them in the public healthcare system.